Hi, this is Dr. Mark Sell, and I did a post yesterday about negative introjects, so I thought I'd do a video to follow up on that. So, negative introjects keep people attached to the familiar, and that familiar is when they were treated in a harsh manner, where they're reprimanded or scolded. So why wouldn't they want to have a positive, or why don't they have a positive introject? Well, primarily because they were mostly treated in a harsh manner, and also a positive. Anybody who's come close to them and might like them, they would have a hard time believing it because they don't believe that they're worthwhile, because that negative interject dominates their life often. And how we work that is to help people express over time their negative feelings towards us as their therapist. And why is that helpful? Um, because they get to know that you're interested in all their feelings, not just that you're going to be admiring them and think you're the next thing to slice bread. Many therapists will hang on to those positive feelings because they don't want to deal with the negative, and that's hard for therapists to deal with the negative. Um, it's hard for most people. They're much more comfortable with the positive. But if we can elicit those negative feelings when the patient's ready, and that's a very important part, when the patient's ready, they can be have much more hope for getting better and healthy. And how we do that is we gently tease out the negative transference. Well, first of all, you don't gently tease it out. You address the negative transference right away. If you can, if you can notice it's there, and you can help the patient talk about it right away. And so, how do you elicit it? How do you move it from the ego to the object world? Well, the therapist is always the object world for the patient. You become their whole life. You're very important to them. You have a lot of meaning to them. So you're it. Even though they don't feel positive about you, they will come to be if you do treatment well with them and are understanding and compassionate and willing to hear all their feelings. And hopefully that's all we all want to do, that is to hear all their feelings. But the negative is an insult sometimes for therapists, because they've been insulted. They have their own negative interjections in themselves. I think we all do, but therapists have them also, and they're a very difficult position because they're there to help people, and they might not want to be perceived as being unhelpful, not doing well, for instance, or criticized. So I think that's one of the reasons why we as therapists stay longer over the session with patients, because we feel inconfident. We don't feel like we've helped them enough. So the motive for that kind of countertransference reaction is to stay over time, which is often justified by therapists. Well, they need more time. They needed more time. Well, that may be sometimes, but it's not generally the case. So how we do it is we help the patients criticize us about whatever. Like, I was working with somebody, and he was he wouldn't say anything harsh to me for a long time. But one time I asked him about the room and what he thought about the room that he was in, my office. So he didn't want to talk about it, but he did say, well, that ceiling. At that time, I had a tin ceiling in the roof, in the ceiling. I mean, so that was from way back. When they built apartments, they had tin ceilings. So I don't like that tin ceiling too much. I says, oh, what else? So we moved around the room, and he said, well, that chair over there, that really could belong in the basement. So I says, oh, what else? So he moved around, and he stopped at my paintings, because they were obviously done by me, and so he didn't want to go further than that. But that's what we need to do, tease out slowly, when the patient is equipped to deal with these feelings and not too threatened by them. They can wonder what a wonderful, safe environment they could have if they could criticize you and not be thrown out of the office or reprimanded, because that's generally what would happen if they criticized one of their caregivers. and the caregivers didn't respond by accepting that feeling. They often would reject them or punish them, throw them out. So it's a wonderful feeling to have truth and authenticity in being able to say, I don't like what you just said. I don't like the way you're doing therapy. Oh, tell me about that. What don't you like about the way I'm doing therapy? Well, you don't talk enough. Well, how much would you like me to talk? What is it like that I don't talk enough? So you investigate. So I just wanted to say those few things right now, and I'll be back again, either with a written comment, or I will also talk a little bit about therapy and what helps and what doesn't. Okay, so this is Dr. Mark Self for the YouTube channel Therapy for the Heart, and my own practice, my Therapy for the Heart. I also have podcasts up there. You just put Therapy for the Heart into SoundCloud.com or iTunes, and also, as you know, the psychotherapy videos. Okay, so thanks for listening, and I'll be back again. All right, bye-bye.